Hello everyone, welcome to De-Roofing Dentistry. This is Dr. Kushali Arora, and today we are going to discuss diagnosis and treatment planning in detail. So in our last video, I gave you an overview of the steps to fabricate the complete denture. If you haven't watched that video yet, I would recommend you to go and watch that video first and then come back to watch this video in detail. Okay? So, a successful complete denture is not merely the result of accurate impressions, proper jaw relations, or precise laboratory procedures. The success of complete denture treatment begins with comprehensive diagnosis of the patient. In fact, many failures in complete denture therapy occur not because of technical errors, but because of inadequate diagnosis and improper patient evaluation. Every edentulous patient presents with a unique combination of anatomical, physiological, psychological, and social factors. Therefore, before formulating a treatment plan, the dentist must evaluate the patient as a whole rather than focusing only on the oral cavity. Okay? So, without wasting the time, let's get started. Diagnosis. What is diagnosis? Diagnosis is defined as the examination and evaluation of a patient's history, signs, symptoms, and clinical findings to determine the nature of the existing condition and to formulate an appropriate treatment plan. So, the diagnosis will begin at the very moment the patient will enter your clinic. Before examining the patient's mouth, you should start observing posture, facial expression, speech, walking pattern, general appearance, and personality traits of the patient. Okay? These observations often reveal valuable information regarding the physical and psychological status of the patient. Let's start with the patient evaluation. Gait. What is gait? So, gait refers to the manner or the style in which the person walks. Now, types of gaits observed clinically are normal gait. Normal gait is characterized by balanced movements, upright posture, and coordinated steps. And a normal gait indicates good general health and adequate neuromuscular control. Such patients usually adapt well to the dentures. Then, slow and cautious gait. This is most commonly seen in advanced age, patients with muscular weakness, arthritis, and general debility. These patients often require short appointments and additional support during their treatment. Okay, then we have unsteady gait. Unsteady gait may suggest neurological disorders, vestibular disturbances, Parkinson's disease, or stroke related deficiencies. Such conditions can affect muscle coordination, denture control, and adaptation to the prosthesis. Then we have shuffling gait. This is commonly seen in Parkinson's disease. Patients may have difficulty controlling denture due to impaired muscle coordination. Okay. Then, after gait, the next trait is the age. Age is one of the most important factors influencing the complete denture. However, in prosthodontics, you must evaluate not only the chronological age but also the physiological age. Now, what is chronological age and what is physiological age? So, chronological age refers to the actual age of the patient measured in years. For example, A patient who is 65 years old has a chronological age of 65 years. What is physiological age? Physiological age refers to the functional condition of the body tissues and organs. Two patients of same chronological age may differ significantly in health status, muscle tone, tissue quality, and healing ability. Therefore, physiological age is often more important than the chronological age. Now, age-related changes affecting the complete denture treatment are changes in the oral mucosa. With increasing age, epithelium becomes thinner, tissue elasticity decreases, mucosa becomes more fragile. As a result, tissue injury occurs more easily and denture soreness may increase. Then, the residual alveolar ridge. Bone resorption progresses continuously after tooth loss. Consequences include reduced denture stability, reduced retention, increased treatment difficulty. Okay, then salivary changes. Elderly patients frequently experience reduced salivary flow and xerostomia. This may result from either aging, medications, or systemic diseases. Dry mouth adversely affects the denture retention. Okay, then comes the muscular changes. There is often reduced muscular tone and reduced neuromuscular coordination. This can compromise denture control. Okay, and the fifth is psychological changes. Older patients may have previous denture experience, possess stronger expectations, show apprehension towards treatment. Proper counseling becomes essential. Okay? Then the next factor is the sex. So, gender is an important determinant of facial appearance and aesthetic denture design. Traditionally, prosthodontics considered gender during selection and arrangement. Although modern prosthodontics emphasize individually understanding gender related characteristics remain valuable. So the male patients generally have angular face, prominent jaw, and strong musculature. Dental characteristic artificial teeth selection may demonstrate greater angularity, squarer outlines, pronounced line angles. These features contribute to a masculine appearance. Then, female patients generally exhibit softer facial contour, rounded profile, and delicate appearance. And so, artificial teeth may need to display rounded contours, softer line angles, and graceful appearance. These characteristics contribute to feminine aesthetics. Okay? Then, after the gender, comes the complexion and personality. Complexion refers to the overall color characteristic of skin, hair, and eyes. It is an important consideration during the tooth shade selection. Importance of complexion is natural appearance depends on harmony between facial features, skin tone, and artificial teeth. Teeth should complement the patient's complexion rather than appear unnaturally bright or artificial. Okay? Fair complexion, often associated with lighter tooth shade and less saturation, while the darker complexion is often harmonized with slightly deeper shade and increased chroma. Okay, then the personality. Personality refers to the characteristic pattern of thinking, feeling, and behavior displayed by an individual. Personality greatly influences the success of complete denture treatment. So, we should observe how's the patient communicating. If the patient is friendly, reserved, or aggressive, then we should also observe the patient's emotional stability. If the patient is calm, anxious, or irritable, okay? So, patients with positive personality generally cooperate better, adapt faster, and report higher satisfaction. Understanding personality allows us to tailor communication and management strategies. Okay? Then after comes the cosmetic index. So, the cosmetic index refers to the degree of importance that the patient places on personal appearance and dental aesthetics. It reflects the patient's aesthetic awareness and expectation. So, based on cosmetic index, the patient is classified as class 1, class 2, and class 3. So, the class 1 patients are more concerned about the treatment and wonder if their expectations can be fulfilled. Class 2 patients are moderately considered about the aesthetics. They are patients with nominal expectations. Then comes the low cosmetic index patients. These patients are not bothered about the treatment and the aesthetics. It is very difficult for the dentist to know if the patient is satisfied with the treatment or not. Okay. Then after the cosmetic index comes the mental attitude of the patient. So, the most widely accepted psychological classification in complete denture prosthetics was proposed by House in 1950. He classified patients into four classes: physiological, class 2 exacting, class 3 hysterical, and class 4 indifferent. The physiological patients are more rational, calm, cooperative, trusting, and emotionally stable. Okay, they understand the complete dentures are artificial substitutes and have limitations. Prognosis in such patients is excellent. These patients usually adapt well to the treatment. Okay, then comes the exacting patients. Characteristic of exacting patients is demanding, meticulous, highly critical, and analytical. They want detailed explanation and often question every procedure. Prognosis in such patients is fair to good. Success depends largely on communication. Okay? Then comes the hysterical patients. These patients are characterized by emotionally unstable, excessively anxious, unrealistic expectations, and frequent complaints. They often expect dentures to function exactly like natural teeth. Prognosis is poor in such patient. Adaptation is often difficult. Okay? These patients require significant psychological management. Then comes the in different patients. These are uninterested, unmotivated, passive, and neglectful. They often show little concern regarding the treatment outcome. Prognosis and questionable in such patients because lack of motivation may affect denture success. Okay, so we have reached the end of part 1. In next lecture, we will start discussing the clinical history taking. So if you liked my today's video, please do share and subscribe my channel. Thank you. Bye bye.